Hello, we're back with more Talking Law TV, and we're here with Gene Brooks. And Gene, you brought a friend.
Yeah, this is a special guest. He kind of hangs out at my office. We call him, it's our skeleton in the closet there.
Well, it looks like it's been a while since he ate.
Yeah. He's been around quite some time.
And you brought him because we're talking about spinal injuries today.
Right, and I just want everybody to get an idea of how important the spine is.
Okay, and then tell us about the functions.
The spinal cord, it runs inside these vertebrae and runs down, as you can see, from the waist all the way up to the brain. And injury to it is pretty significant because, and it's considered a central nervous system injury as opposed to a peripheral nervous system injury, because all the nerves from the brain come through the spine. And then from there, they are dispersed on the peripheral nerves to the hands and the feet and to the other areas.
I think we have an illustration here that sort of shows that, and you'll see the nerves start to spread out there. Yeah,
and those are the muscles that are being innervated by the nerves. The nerves are, that's probably a better picture of the nerves. Well, you got lots of the areas the nerves are, and then the blood vessels as well.
And then there's just the...
Yeah, that just shows how it moves, and this shows the vertebrae with the facet joints and how it moves, and this is probably a range of motion type of test that's used to determine if the spine itself has been injured.
And then just your basic Gray's drawing there.
Yeah, and this is a good drawing, and from this you can see the different areas of the spine, because particularly on the drawing that's at the far right, you can see that there are three primary areas of the spine. There's the cervical spine, which is the first 7 vertebrae, which we would call the neck. And then there's the middle, the vertebrae, which are from T1 to T12, the thoracic spine, which I guess we would call the middle back. And then there's the lumbar spine, which is the lower back, which is L1 through, I think, L5. And then you have the sacrum, which is this area. And I'm going to turn this around. You can see it. So this is the sacrum, or the sacrum area down here, where you can see all the nerves coming out and going down to the legs. And these areas are fairly well fused, whereas all the vertebrae above here are limber.
Yeah, and it's fascinating. I had the opportunity a couple of years ago to go to Body Works, where they have human bodies taken apart, real ones.
Yeah.
And you see the size of the nerves, and you think about a nerve being itsy-bitsy. These things were like the size of ropes.
Yeah, okay, yeah. They're carrying a lot of fibers, and there are all these electrical impulses. They look like a wiring.
They do. It looks like the wiring. If you've ever been to Gulfstream, it looks like the wiring harness for a plane. They just go everywhere.
Yeah.
It was fascinating. I would encourage anybody, if you had an opportunity to see that exhibit, to take it in.
Yeah, they had it up in Atlanta, I think.
They did. When it travels around the country, I think there's 4 or 5 of them.
Okay.
And some jokingly, they say they're made out of Chinese prisoners, but you know, you can obviously tell the people were Chinese. But it's just the fascination of of how the body's put together, and the miraculous way that it works is fascinating.
It's very complicated.
And then you as an attorney, I mean, I've said this on other shows. I mean, how do you know all of this? You just, I mean, I know you specialize in this kind of practice.
Well, you read a lot.
Yeah.
And then after you do it for a while, I've been doing it for 25 years, so you learn a lot during that period of time, because every injury that comes in is a bit different. And you have to learn something new, really, with each injury.
So in car accidents, workers' comp cases, and so forth, injuries to the spine can cause all kinds of other problems.
Yeah, injuries to the back are fairly common, and they can be very many types. I'm going to turn this around, and you got another picture there, which is good, because this picture you have shows this area of the spine here, which is the lower spine.
Yeah, I think on our screen here it's
the lumbar, yeah. And you can see there the disc, and the top disc in your picture here is the normal disc, and that's sort of the padding between the vertebrae, which are the bony part of the spine, and when I say the spine, actually, I guess I should call this the spinal column, because they're the nerves that are going down this spine, which are so important, and they're nerve roots which are coming out of the maybe we could go back to the drawing here. You can see these nerve roots that are coming out of the spine, and as Michael says, they're big. And these are carrying the wiring down, in this case, to the hips and the legs. And as the nerve roots go up, they carry it to different parts of the bodies, maybe to the hands and to the neck. And also, it's taking information. These are two-way streets. They're taking information down to the toes or to the legs, and they're getting information back. And there are really two types of nerves you have here. They're motor nerves and they're sensory nerves. And motor nerves, of course, are moving things, and the sensory nerves are sensing.
So when you're in court and you have to go to the extreme to bring bones here over to show this, do you often have medical experts come in as well?
Yeah, and you can have many different types. Neurologists are, of course, the specialists on the nerves, and they can talk about the testing they can do, such as the EKGs, particularly injuries maybe to the peripheral nervous system or injuries to the spine. Neurosurgeons often can discuss injuries that are occurring to the spine, such as a herniated disc. Orthopedic surgeons also do spinal surgery, particularly on discs. And chiropractors who can talk about subluxations, which are shifts in the vertebrae that can be shown on x-ray, which can pinch the nerves. And we've shown the nerves already that can be pinched. As those nerves, say, they're as big as your finger. And if the bulge here if a bulge from the disc is impinging on that nerve, then you're going to have a lot of pain, and you're going to have loss of sensation and probably loss of motor ability in that nerve.
Yeah. How are chiropractors viewed by the courts? Because I was in Atlanta recently and talked to an attorney up there, and he said a lot of people are switching to PT instead of chiropractors because juries are having a hard time with chiropractors.
The physical therapist. Well, most physical therapists make very good witnesses. Chiropractors can make good witnesses too. It's a different area of practice. After chiropractic came out of Dr. Osteop DOs. They're MDs and they're DOs. Osteopathy, I believe they call it. And then chiropractic came out of that. And that study. And they're very specialized on the functions of the spine. I prefer to have the chiropractor diagnosis confirmed by the neurologist or the orthopedist as well, because sometimes the orthopedist or the neurologist will refer a patient to a chiropractor for maintenance.
And that's for the pinched nerve as opposed to something more seriously damaged. Where moving it around is going to help some.
Yeah, if you can keep, the chiropractic theory is to keep motion in the spine, to keep it limber, so you don't get you don't have it tighten up and become fibrotic or have a lot of the scarring. You want to keep it limber so that it's supple and that it moves. And physical therapists do similar activities. They do it in different ways.
Okay. And we've talked before about when someone's in a real bad accident that some of these will be fused together. So that's actually when the rubber part there is taken out and the two pieces
if we could focus down here, this is these three joints here can be problematic. This is L4, L5, and if this disc here is, let's say this disc is ruptured, and so it's impinging on this nerve here, or you can take this disc out, and then you can put a piece of bone in here, and then the surgeon will attach hardware, actually screws into the spine here and here, and you will have a fixed joint. I mean, you'll lose movement in it. And eventually that area and that bone will all fuse together, but that is a fusion surgery.
So when you have to go to court and you have examples like that, that's pretty much a no-brainer compared to chiropractic treatment.
Well, it's certainly an injury that you can see and you can take